Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the Guyton Academy. This is our sixth experiment from the physiology blood practicals. Bleeding time by Duke method. Requirements. The requirements for this practical are a lancet or pricking needle to prick the finger, a filter paper, a stopwatch, and alcohol swab to clean your skin. I will briefly explain you the procedure. First of all, you have to mark the timing on the filter paper like 30 seconds, 60 seconds, 90 seconds and so on with a gap of 30 seconds. After that, clean your skin with the alcohol swab and prick your finger. And just after that, touch your finger on the filter paper, for example, with 30 seconds and then on 60 seconds and after 30 seconds on 90 seconds and continue until there will be no bleeding or no stain on the filter paper. This will give you the bleeding time. Don't be confused between bleeding time and clotting time. In the clotting time, we use a capillary tube to see the fibrin clot is formed or not. In the bleeding time, in this practical, we use filter paper to see the bleeding time, when the bleeding stops. What is bleeding time? Bleeding time is a laboratory test that measures how long it will take for a small wound to stop bleeding. It is the time from the time of prick until the bleeding stops. What is normal value of bleeding time? The normal bleeding time ranges from 2 to 6 minutes. What is primary hemostasis? Primary hemostasis is the formation of a weak platelet plug which is achieved by four phases: vasoconstriction, platelet adhesion, platelet activation and platelet aggregation that will stop the bleeding. What happens when platelets come in contact with damaged vessel? Damaged blood vessels send out signals to the platelets. Then platelets rush towards the site of damage and activate a lot of clotting factors in the blood, ultimately form a plug or a temporary clot to fix the damage. But this is not the clot, this is the plug basically. That is aggregation of platelets on the side of damaged area to stop the bleeding. This is a long topic, hemostasis. So to understand the complete procedure of hemostasis, you can watch my another complete lecture on the topic of hemostasis and clotting cascades. That is a entire different topic. But here I mentioned the primary hemostasis because this is a part of this practical. What is the role of platelets to stop bleeding? Platelets are essential for blood clotting. They aggregate at the site of injury and stick together to form the platelet plug to stop bleeding. What are three common methods for measuring blood bleeding time? Duke method, IVY method, and template method. What advantages does IVY method have over the Duke method? Means why IVY method is better than Duke method? The IVY method is more standardized due to the controlled pressure, providing more reliable results compared to Duke method. Why we use Duke method rather than IVY method in our lab? Because of convenience. Because Duke method is easy to perform in our lab. What is the purpose of bleeding time test? Or in other words, what does the bleeding time test primarily assess? Why we perform bleeding time test? The bleeding time test assesses the initial phase of the blood clotting, primary hemostasis, specifically evaluating platelet function and vessels integrity, because in some cancers, the integrity has been damaged and there is internal bleeding. So we can check the functions of the platelet and vessel integrity by using the bleeding time test. Which bleeding time method involves pricking the earlobe or the finger? Duke method involves the pricking the earlobe or the fingertip. Why is blood pressure cuff used in some bleeding time tests? In IVY method, a blood pressure cuff is used to apply a standardized pressure of 40 mm of mercury to the arm, ensuring consistent conditions for the test. So it is IVY method in which we use blood pressure cuff to check the bleeding time. What is the main difference between Duke and IVY method? The Duke method involves pricking the earlobe or fingertip, while IVY method involves making a standardized cut on the forearm and apply controlled pressure. Why is the bleeding time test not commonly used today? The bleeding time test is not commonly used today due to its limitations in accuracy and sensitivity compared to newer tests just like platelet function analyzers and platelet aggregation studies. Additionally, bleeding time can be influenced by various factors and may not always provide a reliable assessment of hemostasis. What are two modern tests that can replace the bleeding time test? Two modern tests that can replace the bleeding time test are platelet function analyzer and platelet aggregation studies. What does thromboelastography measures? Thromboelastography measures the entire process of clot formation, providing a comprehensive assessment of hemostasis. What precautions should patients take before bleeding time test? Patients should avoid taking aspirin or non-steroidal anti-inflammatory drugs, जिसको हम NSAIDs भी कहते हैं, as these medications can interfere with platelet function and affect the test results. So, patients should avoid use of these medicines before or a night before the test performed. How does aspirin influence the platelet and bleeding time? Aspirin inhibits the production of thromboxane A2, which is a substance that promotes platelet aggregation in primary hemostasis. So, it will lead to prolonged bleeding time. Which medications may increase bleeding time by affecting the platelets? Aspirin and NSAIDs. Mention the name of any blood thinner and how do blood thinners affect the bleeding time? Heparin is a common blood thinner and blood thinners like heparin increases the risk of bleeding by interfering with the blood clotting process. What are the clinical conditions in which the bleeding time is prolonged? Like thrombocytopenia, a decrease in the number of platelets. Thrombocytopenia, defect in the platelet function. Increased capillary fragility, often seen in older age or cancers. Prolonged aspirin use, aspirin inhibits the platelet function. So these can be the conditions in which we found longer bleeding time or delayed bleeding time. What might longer than a normal bleeding time indicate? What a prolonged bleeding time indicate? There are several factors So in previous slides I mentioned only four things, but here I have mentioned more, like already explained the problems with the platelet function, blood vessel integrity, von Willebrand disease, thrombocytopenia, liver disease, effect of medicines, allergic reactions, autoimmune reactions, vitamin C deficiency. All these factors can prolong the bleeding time. What is von Willebrand disease? Von Willebrand disease is a common inherited bleeding disorder caused by deficiency or abnormality in von Willebrand factor, a protein essential for platelet adhesion to blood vessel. How many types of von Willebrand disease exist? There are three types of von Willebrand disease exist. Type 1, Type 2 and Type 3. Type 1 is partial deficiency, Type 2 is qualitative abnormality, and Type 3 is severe deficiency of von Willebrand factor. Why does leukemia lead to prolonged bleeding time? Leukemia is basically a cancer of blood forming cells, which can interfere with the production of platelet in the bone marrow. So this will lead to increased bleeding time. How does chronic kidney disease impact the bleeding time? Chronic kidney disease can lead to accumulation of toxins in the blood, which can interfere with platelet function and contribute to prolonged bleeding times. What role does liver play in bleeding time? How does liver disease affect it? The liver plays a crucial role in the production of clotting factors. Liver disease can impair the liver's ability to produce these factors, leading to prolonged bleeding time. Because liver produce a lot of clotting factors which are important for the hemostasis. So deficiency of these factors can lead to prolonged bleeding time. Thrombocytopenia. This is the qualitative platelet defect, meaning it affects the function of the platelet rather than the number. However, what is thrombocytopenia? It is the condition characterized by low platelet count. What are three potential causes of thrombocytopenia? Bone marrow failure, aplastic anemia, right? Immune related destruction of the platelets like idiopathic thrombocytopenic purpura, drug induced low platelet count like chemotherapy. All these can cause thrombocytopenia, and thrombocytopenia will lead to longer bleeding time. How does aplastic anemia affect the bleeding time? Aplastic anemia is a condition characterized by the failure of bone marrow to produce blood cells, including platelets. So ultimately, this will lead to prolonged bleeding time. How does Glanzmann thrombosthenia affect the bleeding time? Glanzmann thrombosthenia is a platelet disorder characterized by the deficiency of platelet glycoprotein 2b3A receptors. This leads to impaired platelet aggregation function and prolonged bleeding time. What causes Bernard-Soulier syndrome? Bernard-Soulier syndrome is a platelet disorder caused by deficiency in the GP1b10 complex. And again, it will lead to increased bleeding time. Although these are quite high standard questions, but maybe if you know more, it will helpful in your viva. So I put some more extra questions, maybe, and that can be asked in your exam, and it will benefit you. How do storage pool disease impact the bleeding time? Storage pool diseases are platelet disorder characterized by deficiency in platelet granules. This will lead to prolonged bleeding time. Which clotting factor is deficient in hemophilia A? Factor 8 is the clotting factor that is deficient in hemophilia A. And in hemophilia, there is prolonged bleeding time. Can severe hemophilia affect the bleeding time? Yes. Severe hemophilia A or B can lead to prolonged bleeding time due to impaired clotting factors. Clotting. What is the primary issue in Ehlers-Danlos syndrome that causes the prolonged bleeding time? Ehlers-Danlos syndrome is a group of inherited connective tissue disorders that can affect blood vessel integrity, leading to prolonged bleeding time. Because, in the initial phase of the primary hemostasis, we need vasoconstriction. So, whenever there is a connective tissue disorder, it will cause prolonged bleeding time. How does vitamin D deficiency impact the bleeding time? Vitamin C is basically essential for the collagen synthesis. Vitamin C is essential for the collagen synthesis, a protein important for the blood vessel integrity. So, a deficiency in the vitamin C can lead to weakened blood vessel and prolong the bleeding time. What occurs to the blood vessels in hereditary hemorrhagic telangiectasia का मुझे भी नहीं बोलना आ रहा telangiectasia whatever it is a genetic disorder characterized by the formation of abnormal blood vessels which can be fragile and prone to bleeding. How does clopidogrel cause longer bleeding time? Clopidogrel is an antiplatelet agent that inhibits the P2Y12 receptor on the platelets, preventing their aggregation and leading to prolonged bleeding time. Thank you so much. I know the last 3 or 4 slides are quite difficult, or you can say not in your book, but if you read, better for you. So, good luck for your exam. This is about the bleeding time. Thank you so much.